Demystifying medicine, clearing the air, unmasking the link between air pollution and breast cancer. Breast cancer is the leading cause of illness in women worldwide, affecting 1 in every 8 women. Several factors can contribute to the likelihood of developing breast cancer, including a woman's reproductive and family history. If girls get their period at an early age, or if women start menopause later in life, they are exposed to hormones for many more years than the average female's reproductive cycle. This leads to a higher risk of developing breast cancer. Alcohol consumption and obesity increase the probability of developing breast cancer as well, as women's metabolisms can be altered, leading to the creation of cancer cells. In addition to the risks listed prior, environmental factors can also play a significant role in the development of breast cancer. Fine particulate matter is a term used to describe pollution created from car exhausts, oil or coal combustion, or industrial emissions, to name a few. Particulate matter is composed of metals, including sodium and nickel, metalloids, like silicone, and scientific compounds, including ammonium, sulfate, nitrate, and ozone, and it is officially classified as a human carcinogen, which is a term to describe a substance that increases one's risk of cancer. Many contents of fine particulate matter disrupt the body's natural hormonal regulation system, but it isn't very clear if particulate matter specifically is associated with breast cancer. To further understand this complex relationship, a research study investigated the relationship between fine particulate matter and breast cancer in the United States and various geographical locations. This study was performed on an older group of adults living in various different states in America, such as California, Florida, Louisiana, New Jersey, North Carolina, Pennsylvania, Georgia, and Michigan. 567,769 older individuals are members of the AARP organization, or the American Association of Retired Persons, and they were all mailed a questionnaire between the years of 1995 and 1996. The questionnaire allowed members to provide information on their demographics, lifestyle factors, along with other cancer risk factors, with a follow-up questionnaire sent a few years later. Participants were screened, and 196,905 females who did not have any prior history of any type of cancer were chosen for the study. To measure the exposure levels of the participants, the researchers used a reliable model called the PM2.5 model to predict the levels of fine particulate matter in specific locations and times. The data used in this study was collected by the U.S. Environmental Protection Agency between the years of 1999 and 2012, and they analyzed the trends in PM2.5 levels from the years of 1980 to 2010. The model was able to estimate the annual average of PM2.5 in the area that the surveyed members lived in from 1980 all the way to 2010. Since most of the women in the study were postmenopausal, the analyses conducted were focused on this group. Further analyses were conducted on 2 subgroups of women, one with at least 10 years of follow-up, and the other being women who had received a mammogram within 3 years prior to the study. To understand the relationship, statistical models were used to examine the relationship between PM2.5 levels and the development of breast cancer. The final number of participants being studied after all adjustments were made were 179,450 individuals. On average, with almost 17 years of follow-up, there were a total of 15,870 cases of breast cancer identified, with 92% being postmenopausal women. The mean age of study was 62 years, and most were non-Hispanic white women. The mean PM2.5 concentrations were lower for Florida residents and higher for women living in California or Pennsylvania. Non-Hispanic Black participants made up only 6% of the participants overall, but they made up 12% of women in the highest exposure quartile. There was an 8% increase in overall breast cancer risk, showing that PM2.5 was associated with overall incidence of breast cancer. It was shown in estrogen receptor positive tumors, where estrogen is a hormone that plays an important role in the reproductive development of women, that there was a pronounced increase in breast cancer risk. It was observed that higher PM2.5 concentrations were associated with higher counts of tissue and tissue sites of where breast cancer is, allowing for tumor development based on rapid growth of these tissues. Hence, long-term historical exposure to ambient PM2.5 is shown to be associated with a higher risk of estrogen receptor positive breast cancer. To gain a more comprehensive understanding, further studies should delve into the regional differences in PM2.5 composition and difference in exposure to understand how these varying levels and specific components might influence the risk of breast cancer. Another factor researchers need to take into consideration is the socioeconomic and racial disparities in exposure to air pollutants and their contribution to breast cancer risk among different demographic groups. Research focusing on these disparities not only provides an opportunity to understand the relationship between environmental injustices and health consequences, but it also allows us to address health equity and shed light on whether certain demographic groups are at higher risk due to their environmental circumstances. By addressing these factors, we can expand our understanding of the correlation between environmental factors and the risk of breast cancer. We can use our knowledge to develop policies that target to reduce exposure to pollutants, to improve the overall health of the public, and decrease the risk of breast cancer.